Hi guys, today we will be talking about metformin. I will touch on three main things, mainly how does metformin work, what are its benefits, and what are its risks. Alright, so how does metformin work? Metformin works in three main ways. The first is that it decreases the amount of sugar that your liver makes. The second is that it decreases how much sugar gets absorbed in your intestines from your food. And last but not least, metformin makes your body more sensitive to insulin. Remember, your pancreas makes insulin to help control your blood sugar, and some people may end up getting insulin prescribed to them if their pancreas isn't producing insulin properly. Metformin will help improve your body's response to the insulin regardless of the source of insulin. So, what are the benefits of metformin? First, metformin lowers A1C by roughly 1% or sometimes more, depending on the dose. Remember, A1C is a measure of blood sugar, and high blood sugar can increase your risk of heart attacks, strokes, kidney damage, and eye damage, among other things. So bringing your blood sugar down to a normal level is important to prevent long-term damage to your body and or death. I would also like to point out that metformin is in addition to exercising regularly, eating less carbs, sugars, and maintaining a healthy weight. Metformin is mainly used to lower blood sugar in type 2 diabetes, but it can also be used in prediabetes, gestational diabetes, if the benefits outweigh the risks, and even type 1 diabetes, although this is considered experimental. All right, so number 2 on our list is that metformin may reduce the risk of heart disease and death. This might be a big factor as to why the American Diabetes Association recommends metformin first line for type 2 diabetes before other diabetes medications. Number 3 is cost. While there are several diabetes medications out there that are hundreds of dollars per month, metformin is very cheap, which is nice. Number 4, metformin has a low risk of low blood sugar episodes, also known as hypoglycemia, which is something that we worry about with other diabetes medications. Number 5, metformin may also help a little with weight loss, but this is usually pretty minimal. And last on the list here is metformin is also beneficial in polycystic ovary syndrome, also known as PCOS. This is thought to be related to how metformin improves insulin sensitivity, which can potentially affect hormone imbalance. Okay, so what are the risks of metformin? Keep in mind that this is not an all-inclusive list, just the ones I thought were the most important to note. First on the list here is metformin can cause stomach upset, gas, bloating, and diarrhea the first few weeks you take it, so it is important to take metformin with food and start off at a low dose, after which your doctor will probably taper you up. If you still have trouble tolerating metformin, there is an extended release version that has lower rates of these types of side effects. And as a side note, you may have heard that there were a few batches of extended release metformin recalled a while ago due to potentially cancer-causing impurities, the same stuff that caused recalls of Zantac and certain blood pressure medications. This does not apply to regular metformin, just certain batches of extended release metformin that have since been removed from the market. Number 2 on our list is that taking metformin for a long time can lead to low vitamin B12 levels, which can potentially lead to certain types of anemia and nerve pain symptoms. Thus, it is important to have your doctor check your vitamin B12 levels periodically if you are on metformin for years and years. Some people like to take a vitamin B12 supplement while on metformin for this reason. Last on our list is that metformin has a potential risk for lactic acidosis, which is extremely rare. Lactic acidosis is basically when you have too much lactic acid built up in your blood, which can affect the biochemistry in your body and cause some very serious issues. This is why we pay attention to metformin in your kidneys. A very common misconception is that metformin hurts the kidneys, which is not necessarily true. The danger is that if you already have low kidney function, the metformin does not leave the body properly, so it can build up to toxic levels and increase the risk of lactic acidosis. All right, so if you learned something today or found value from this video, make sure to hit that like button. If you want more easy to understand content on health and medicine, make sure to subscribe to the channel. And last thing, this video is for educational use only. This video is accurate to the best of my knowledge as of the date posted, but data is always changing, so always consult your doctor and pharmacist regarding your medications and what would be best to do in your specific situation. Thank you for your time and stay healthy. See you next time.